Good evening, my lovely, and welcome back to Calm with Carla ASMR. So in tonight's video, I'm going to be doing a dental exam on you. So before we begin, I'm just going to get some details from you, if that's okay. Perfect. So can I get your name, please? Perfect. And your date of birth? with some water. Just pop a little bit of water in here. Not too much. There we go. That's ideal. Alright, pop that back. Now I'm just going to pop the lid on and just shake it up so it turns into a nice anesthetic solution. Shake it up, shake it up. So tell me, anything nice in your day today? What have you been up to? Okay, that sounds really good. Just going to pop this mask off a minute whilst I do this. These get quite hot to breathe in. Wow, that sounds really exciting. So do you have any plans for the rest of the day after this? Wow. Well, unfortunately, my plans goes as far as looking at people's teeth, so that's, right, I'm just going to put some of this into my little injection, just prep it, you know, get the air out of it. There we go. Now I'm just going to pop that there, just to let it settle for a little minute. So, well, your plans for your day sounds really good, so awesome. Sadly, it's just a shame we've had to come to the dentist in the middle of all that. But there's not much we can do, is there? No, you're right. Anyway, I'm going to pop my mask back on and just tighten it up around my face. Okay, now again, if you open wide, just stick your tongue out and say, ah, please. I'm going to pop this thing in your tongue, just hold it down a minute. Whilst I have a look to see where I can inject. Good. Right. So I'm going to take my little injection and my torch, and we're just going to inject at the back of your teeth here. Delicate job, okay? And that's you. Now that may take a couple of minutes just to seep into your gums, so in the meantime, take my mask off again and tell me about yourself. So what do you do for fun? Oh wow, really? I love doing that too. Awesome. What about your job? Anything exciting? Interesting. I've always wondered about that career, but dental is my calling. Well, that's awesome. Okay, give that a little bit longer just to settle in. Gonna have a little look through the rest of your mouth whilst we wait. But I put my mask back on. Right, another mirror. I'm just going to have a quick look at the top of your top teeth, if that's okay. Just open wide and say, ah. Yeah. Okay. I'm seeing a little bit that could probably be scraped from the top too. So just while we wait for your anesthesia to completely work, I'm going to scrape a bit of the top teeth, if that's okay for you. Perfect. Scrape, 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 scrape. So I'm just going to ask you a couple more questions. So, how often do at night? Is that after you've eaten, obviously? Perfect. Yeah, it's good to not have sugar on your teeth when you go to bed. And just out of curiosity, how often do you floss your teeth? Oh, okay, not pretty often, okay. Yeah, that's quite a common thing with people. They just don't floss as much as we really should be flossing every day. Even I, as a dentist, struggle to remember sometimes. It's just humans, we all forget. And mouthwash again, probably should be using that every day, but the majority of patients I see don't even use it at all. But that's fine, it's fine. It's what we're here for, to help you keep your teeth in best shape possible. It is very hard, especially when you're in a rush in the morning, to try and remember this 3-step teeth routine. I totally get it, don't worry. It's just another one of those things, isn't it? Anyway, I believe your anesthesia should be about ready, so I'm going to give it a gentle prod with my kind of softer, pokey tool. Just pop my mask back on. Okay, right. So, just please let me know if you can feel anything at all, and then we'll add more of your anesthesia solution. Okay, so if you feel any pokes or jabs on your gums at all, just let me know, okay? Right, I'm starting to poke just now. Can you feel anything at all? Not so far. Okay, let me try just a bit from the back there. Anything? No, it's all clear. Excellent, that's what we like to hear. Well, in that case, I guess we're going to get to work on your teeth. So you did come in for a bit of tooth decay and pain on and off, is that correct? Well, I think your wisdom tooth is going to have to be extracted. Yeah, it's not the nicest thing to experience, but once they're out, they won't be a pain ever again, quite literally. So, I'm just going to prep my drill and my extractors. Okay. Well, you should not feel a thing, and if you feel the slightest bit of pain, just nudge me, say stop, anything, and I'll add more anesthesia right away, I promise. As the last thing I want is my some painkiller. And we'll just put all your details at the top. And I'll just need to make sure I sign. And then I said mouthwash use twice daily. And I'm also going to prescribe you a sodium fluoride toothpaste. Just going to give you 4 tubes and just keep using that, okay? And if you do need more, I will request it be put on your repeat prescriptions. So I'll lay that there for you at the side. And you can just take that to any pharmacy to be dispensed. Well, just whenever you are ready, that's you all done. I'm going to write you a little note to see me again in 3 months, see how that stitches are healing up, just general checkup, and we can maybe even do a cleaning of the teeth too. That might be an idea. So I'll just put that as a quick note here. 3 months from now is about April maybe. That should be fine. And if you give that piece of paper to my receptionist at the front, she will be able to book you in 3 months, obviously around April time. And it's been great to see you, see how you're doing, but our phone number is on our appointment card, so if you have any pain, discomfort, or anything like that, just don't hesitate to call and make an appointment sooner, because it could be infected or anything. And also, yes, just keep an eye out. It does get tender or painful. It maybe is infected, but just make sure you use that mouthwash, and that should be avoided completely. Is that all okay? Any questions before we come to a close, or any questions before our appointment comes to an end? Okay. Yes, the mouthwash should be used before you brush your teeth twice daily, obviously, because if you use it after you brush your teeth, it gets rid of the sodium fluoride coating on the teeth that you've just brushed on, so it kind of doesn't make sense. And yes, I also do recommend you brush your teeth before eating in the morning. A lot of people don't do that, so anything that is on the teeth from sleeping, they're just eating cereal, sugary cereal, and adding to that, and it just doesn't help the teeth at all. So definitely brush it as soon as you get up. You will thank yourself. Any other questions? Yes, it will be me you're seeing next time too. Well, if you have any further questions that you think of, like, say when you get home and you're like, oh, I wish I'd asked that, do not hesitate to give us a call, and my receptionist will pass you right on to me. If I'm not obviously in like a dental appointment, but if not, you can leave a message with her, and yeah, she'll be happy to get an answer back to you as soon as possible. Well, thank you for coming to the CAM clinic, and I really hope to see you again soon in 3 months or so. If not sooner, hopefully not sooner, because that means there's something gone wrong with the tooth, but you know. Well, I'll see you to the reception.